What is a clinical practice guideline? Clinical practice guidelines are systematically and transparently developed recommendations meant to inform professionals and service users about the most effective interventions available in specific circumstances. These recommendations are grounded in the best available evidence and knowledge. Topics that a guideline may cover include the provision of a given service or the screening, diagnosis, management, or monitoring of a condition for a specific population. For example, a guideline may focus on the evaluation of dyslexia in children or on the treatment of major depression in adults. The Institute of Medicine states that in addition to evaluating the evidence regarding an intervention, guidelines should provide an assessment of the harms and the benefits of the recommendation. In addition, guidelines should provide an analysis of the cost and feasibility of implementing the recommendations. Practice guidelines therefore involve a joint effort by various stakeholders and experts who collect, analyze, and synthesize diverse data in an effort to mobilize knowledge and ultimately improve services and care. There's often some confusion regarding what guidelines are and what they aren't. First and foremost, guidelines should be understood as suggestions rather than rules. As such, they should not be used as standards of care that have legal ramifications, and guidelines should not, and in fact do not, dictate how a clinician should deliver a service. In a similar vein, guidelines do not replace clinical judgment. Guidelines are intended to be used by trained professionals who can apply recommendations using their best judgment. Therefore, when a valid reason exists not to follow a recommendation put forth in a guideline, a clinician may opt for an alternative method of care. Legitimate reasons for this may include the presence of comorbid conditions, limited available resources, and patient or client preferences. Also, guidelines are not meant to be treatment manuals because guidelines are not meant to provide detailed information regarding a treatment or intervention. Guidelines should not be mistaken for a health technology assessment report. A health technology assessment report is a policy research document that examines the short-term and long-term consequences of the use and the application of technology, medication, or an intervention in health or social services. Guidelines should also not be used as equivalent to standards of practice. Standards of practice are quote-unquote authoritarian statements that delineate the required knowledge, skill, and judgment necessary to practice safely and legally. And lastly, guidelines should not be confused with clinical protocols, which involve step-by-step instructions regarding a treatment or service care provision. All in all, what is important to remember here is that guidelines do not dictate how services ought to be delivered. They do, however, inform clinical practice, bring science to practice, and give clinicians the information they need to offer the best service possible.